Most people believe that regular health checkups are always safe and beneficial. But have you ever considered that some medical tests or screenings could actually create unnecessary problems or even put your well-being at risk once you reach a certain age? It may sound surprising, but not every medical exam is harmless. In fact, some of the most common screenings for older adults can lead to unnecessary treatments, increased anxiety, or even false alarms that do more harm than good. Now, I'm not here to scare you. What I want is to help you see things from a fresh perspective. More and more doctors, especially those who regularly care for patients over 70, are beginning to acknowledge that a one-size-fits-all approach doesn't work as we age. A new reality is dawning in modern medicine. Seniors need a more thoughtful, personalized approach instead of cookie-cutter testing. In this video, we'll explore 5 medical screenings that older adults may want to think twice about before agreeing to. Believe it or not, some of these are tests that even experienced physicians often choose to avoid for themselves. Together, we'll uncover why these exams are so commonly recommended, the hidden risks they carry, and practical, safer alternatives that keep you informed without putting your health in jeopardy. If you're watching this on your TV, don't forget you can easily use your phone or remote to search for our channel on YouTube. Make sure to hit the subscribe button and turn on the notification bell so you never miss out on new videos about health, nutrition, and senior living. And if you find this helpful, a quick thumbs up or a comment below would mean the world to us. We truly value hearing your thoughts and experiences. You deserve health care that respects your body, your age, and your overall well-being. If you care about staying healthy but don't want to be overtreated, overmedicated, or overwhelmed by today's medical system, then this video is made just for you. Our mission is not to frighten you, but to give you knowledge, confidence, and a clearer understanding of what really supports your health after the age of 70. So let's dive right in and get started. Let's begin with what I like to call the colonoscopy trap. For decades, colonoscopy has been hailed as the gold standard in preventing colon cancer. And while this screening can be life-saving in your 50s or 60s, the reality changes as you move past 70, especially if you don't have symptoms or a family history of colon issues. At that stage, what was once considered protective can quietly shift into a source of unnecessary stress, complications, and even hospital visits. Why does this happen? Well, the procedure itself is no small matter. It requires heavy preparation, days of strict bowel cleansing, powerful laxatives that flush your system, sedation, and the insertion of a long scope deep into the intestines. For younger adults, this process is already demanding. But for seniors, the risks escalate dramatically. Something as simple as the bowel prep can lead to severe dehydration and dangerous electrolyte imbalances, conditions that older bodies struggle to recover from. And then there's sedation. Aging bodies tend to respond differently to these drugs. What may be safe for a 40-year-old can trigger dizziness, confusion, or memory lapses in someone over 70, increasing the risk of disorientation and falls. But here's the part that many people don't realize. After the procedure, doctors often recommend follow-up surgeries or treatments for tiny, harmless polyps, abnormalities that might never have developed into anything threatening in the first place. Science shows it can take 10 to 15 years for these slow-growing polyps to evolve into something problematic. For someone already in their 70s or 80s, that timeline may be irrelevant. Yet the discovery of these polyps often sparks fear, and with fear comes a cascade of unnecessary interventions, repeat colonoscopies, biopsies, and sometimes even partial removal of the bowel. Suddenly, what was supposed to be prevention turns into potential harm. I'll never forget one particular case. My friend, let's call him Henry, is 82 years old, full of energy, still sharp as ever, and without a single digestive complaint. Despite this, he was convinced to undergo a routine colonoscopy. The result? The bowel prep left him so severely dehydrated that he required additional medical care, something that could have been entirely avoided. This is the double-edged sword of certain screenings in older age. The intention is noble, prevention, but when the dangers begin to outweigh the potential benefits, it's time to reconsider. After the procedure, my friend was left groggy and confused. Later that very evening, he lost his balance at home, fell, and broke his hip. What followed was months of physical therapy, mounting medical bills, and a heavy emotional toll, all triggered by a test that in the end revealed absolutely nothing. The scope found no cancer, no concerning growths, nothing at all. Now I want to be clear, this isn't about blaming doctors. They're practicing the medicine they were trained in. But medicine itself is evolving, and as it changes, so should the choices we make for ourselves. If you're over 70 free of symptoms and without a family history of colon cancer, it's completely reasonable to say no to a colonoscopy. Today, there are non-invasive stool tests that are far safer, far simpler, and often just as effective for monitoring your health. The real question becomes, is the physical, emotional, and financial cost of such a demanding procedure worth it at this stage of life? After 70, better care often doesn't mean more interventions. It means smarter, more intentional decisions. More tests don't automatically equal better health. Exercising caution isn't neglect. It's actually showing respect for your body and your well-being. Now let's move on to the second pitfall, the yearly full body scan. The very idea sounds incredibly appealing, doesn't it? Imagine a machine sweeping over you from head to toe, promising to uncover every hidden problem before it becomes dangerous. On the surface, it feels like the ultimate form of prevention. But here's the truth for seniors over 70, these scans often create more problems than they solve. Full-body CTs and MRIs are extremely powerful tools designed to detect everything, even tiny irregularities, that have absolutely no impact on your health or lifespan. The problem? These harmless little findings can become ticking mental time bombs. A single incidental spot on a scan can spark waves of fear, leading to endless follow-up tests, invasive procedures, and unnecessary treatments that sometimes shorten life rather than extend it. It often starts with something small, a tiny shadow here, a little nodule there. Before you know it, you're caught in a relentless cycle of follow-up appointments, consultations with specialists, repeat scans, and invasive biopsies. All of this chasing after something that in many cases never would have posed a real threat. Why does this issue become even more critical after 70? Because the aging body doesn't bounce back the way it once did. A procedure that might have been considered routine at 45, like a simple biopsy, can at 75 result in serious setbacks, weeks of recovery, unexpected infections, or even complications such as a collapsed lung. And let's not overlook the physical strain. Holding perfectly still inside an MRI machine may sound minor, but for someone with stiff joints or arthritis, that hour of stillness can feel grueling and painful. Beyond the physical impact, there's also an emotional cost. Instead of focusing on their current good health, many seniors become consumed by the what-ifs, carrying the weight of worry over problems that may never have surfaced in their lifetime. I'll share a story about Margaret, a 78-year-old woman I met at a senior health conference. She was vibrant, energetic, and enjoyed brisk walks every single day. At a community health fair, she decided to try an affordable full-body scan offered by a mobile clinic. The results showed a microscopic lesion on her kidney, something that had never caused her pain, discomfort, or any health issue at all. But the mere mention of the word lesion was enough to spark fear. Within weeks, she underwent surgery. The outcome, months of slow recovery, a noticeable decline in energy and lingering health issues that never fully resolved. All of that for a finding that likely would have remained harmless forever. In medicine, we call this overdiagnosis. On a personal level, it becomes unnecessary fear, and financially, it can drain you as well. Full-body scans are rarely covered by insurance. Seniors often pay thousands of dollars out of pocket, convinced they're buying peace of mind. In reality, they're often buying into an endless cycle of tests and procedures. At this stage of life, true responsibility doesn't always mean chasing down every possible abnormality. Sometimes it means trusting your body a little more, listening to how you feel, and recognizing that not every shadow on a screen deserves your fear or your energy. And if you're still here watching this video, that tells me you value this kind of honest conversation. Let me know your thoughts in the comments below. I'd love to hear your perspective. And if you haven't already, hit subscribe and turn on the bell so you'll always stay updated with our latest videos on health, nutrition, and senior living. Thanks to your continued support, we're able to create high-quality content designed to inform, inspire, and empower you. Now let's move forward to the third hidden trap, the overuse of cardiac stress tests. For decades, the treadmill stress test has been considered the classic tool for spotting heart disease, especially in older adults. The logic behind it seems simple enough: put the heart under pressure and see how it responds. On the surface, that approach sounds reasonable, but once you're past 70, the story changes dramatically. What was once a useful tool in your 50s or early 60s can become unreliable or even dangerous. Here's why stress tests in older adults often generate what doctors call false positives. In other words, the test may suggest there's a heart problem when in fact the heart is working just fine. Why does this happen? Because aging naturally alters the body's systems. The electrical patterns of the heart shift, arteries stiffen, and blood pressure fluctuates more than it did in younger years. These changes aren't always signs of disease, but the test doesn't recognize that it simply flags them as abnormalities. And that's where the real trouble begins. A misleading result can trigger a domino effect of worry and unnecessary follow-ups, angiograms, catheterizations, and sometimes even stents or bypass surgeries. Each of these procedures comes with its own risks that weigh more heavily on seniors than on younger patients. We're talking about drops in blood pressure, internal bleeding, and kidney damage from the contrast dye used in some of these procedures. And let's not forget the harder, slower recovery process that comes with age. What begins as a simple treadmill test can quickly land someone in a hospital bed asking themselves how things escalated so quickly. This is the harsh reality of relying on tests that don't always account for the natural changes of aging. More testing doesn't always equal better care. And when it comes to cardiac stress tests for seniors, sometimes less really it is more. Let me share with you the story of Frank, a 74-year-old retired bus driver. During a routine checkup, his physician suggested a treadmill stress test just to be on the safe side. Frank had no warning signs, no chest pain, no shortness of breath, no unexplained fatigue. Yet once the test results came back slightly irregular, he was quickly referred to a cardiologist. Within 3 weeks, he was on the operating table for an angioplasty to clear a so-called blockage, one that had caused him no symptoms whatsoever. The aftermath was devastating. Within a month, Frank developed a serious infection at the catheter site. He was rushed to intensive care and spent the better part of 6 months shuffling between hospitals and rehabilitation facilities. His recovery was slow, draining, and incomplete. To this day, his quality of life has never fully returned. So was that treadmill test really worth it? The truth is, many respected cardiologists and leading geriatric organizations now recommend against routine stress testing for older adults without symptoms. If you're not experiencing chest pain, unexplained exhaustion, or difficulty breathing, the risks of the test and everything that may follow often outweigh any possible benefit. This perspective is especially important if your goal is to age well, not just to live longer at any cost. There's also a powerful psychological pull at play. The heart feels sacred. It's the rhythm of life itself. Naturally, we want reassurance that it's strong and healthy. But wisdom in aging means recognizing that not every possible concern needs to be hunted down and fixed. Sometimes the pursuit of prevention creates more harm than good. This doesn't mean ignoring your heart, far from it. What it does mean is focusing on the fundamentals, walking daily, eating nourishing foods, managing stress, and staying socially connected. These simple habits do far more to keep your heart strong after 70 than a treadmill test ever could. True health in later years isn't about chasing every potential issue. It's about nurturing the life you have right now. Not every piece of medical technology, not every wire or machine, and certainly not every test designed for people half your age is right for you. At this stage of life, wisdom and discretion matter more than anything else. It takes courage to say no when something is offered, and strength to realize that not every test is a gift. Sometimes the best choice you can make for your health and your peace of mind is to decline. Take colon cancer, for example. Just the thought of it can be unsettling. It's a disease that often develops silently, and by the time symptoms appear, treatment can be much harder. That's why for decades, colonoscopies have been promoted as one of the most essential preventive tools in modern medicine. But here's the part that often goes unspoken. Beyond the age of 70, the risks of colonoscopy can start to outweigh its potential benefits. For many seniors, this test may cause more harm than good. Let's look at the process itself. A colonoscopy requires full sedation, and anesthesia carries real dangers for older adults. As we age, the brain becomes more sensitive to these drugs, while the liver processes medications more slowly. This combination increases the chances of what doctors call post-operative cognitive dysfunction, a condition marked by lingering confusion, memory lapses, and mental fog that can last for weeks or even months after the procedure. And that's just the anesthesia. Then comes the infamous bowel preparation. If you've ever gone through a colonoscopy, you know this part well. drinking large quantities of harsh laxatives to flush out your system. For younger adults, it's unpleasant but manageable. For seniors, though, it can be exhausting and even dangerous. The process depletes the body's fluids, throws off electrolyte balance, stresses the kidneys, and leaves many people drained both physically and emotionally. One wrong step during this fragile state can trigger dizziness, weakness, or even a dangerous fall during a late-night trip to the bathroom. This isn't an exaggeration. It's a very real risk that too many older adults only discover the hard way. Falls related to colonoscopy prep are far more common than most people realize, especially for older adults who live alone. Yet one of the most overlooked issues isn't the prep itself, but something doctors call the time horizon of benefit. Here's what that means. The whole point of a colonoscopy is to find slow-growing polyps that could, over 10 to 15 years, eventually develop into cancer. But if you're already in your 70s or 80s and you've had previous clean results, the odds of those polyps becoming dangerous during your remaining lifetime are very low. In contrast, the risks of the procedure itself rise steeply with age. Complications like internal bleeding bowel perforation and adverse drug reactions become more common as the years go on, while the actual payoff of screening shrinks. Take the story of Helen, a retired schoolteacher aged 78. She had 2 successful colonoscopies earlier in life, one at 68 and another at 73, both completely clear. Yet her doctor encouraged her to do one more at 78 just to be cautious. She agreed. Sadly, the procedure resulted in a perforation of her colon, a rare but very serious complication. Helen spent nearly a month in the hospital recovering from emergency surgery. Though she survived, her independence diminished and she never regained the energy she once had. To this day, she often says she wishes someone had told her upfront that the risks at her age might far outweigh the benefits. Why does this keep happening? Part of it is medical habit. If a test was considered excellent at 50, many assume it must still be excellent at 75. But aging changes everything. What once protected us can gradually become a burden. And while colon cancer is a legitimate concern, many seniors lose sight of their true priorities at this stage of life, preserving mental clarity, emotional balance, and mobility. For the sake of a tiny potential increase in lifespan, no test, no matter how advanced, should be allowed to compromise those foundations. At this age, the smarter path is to stay alert to genuine warning signs, blood in the stool, chronic abdominal discomfort, or unexplained weight loss. In those cases, further investigation is absolutely necessary. But chasing problems that may never appear, that's a choice worth questioning. If you've had a solid track record of clean screenings and you're not experiencing any symptoms, then another routine colonoscopy may not just be unnecessary, it could actually put you at risk. This is where we need to reclaim our personal agency. True healthcare isn't about blindly following procedures because that's what people your age are supposed to do. It's about weighing the trade-offs, making informed choices, and remembering that your body deserves respect, not exposure to risks that no longer offer meaningful benefits. And before we continue, let me know in the comments, drop a note in section 4 below, if you're still here watching and finding this content helpful. Don't forget to hit subscribe and turn on the bell if you haven't already. Your support allows us to keep creating high-quality videos designed to educate, uplift, and guide you toward smarter health decisions. Now let's move on to the 5th area of concern, the overuse of cardiac stress tests. There's something about heart disease that feels especially frightening. It's often portrayed as a ticking time bomb. You've probably heard the stories of people who seemed perfectly fine one day only to collapse the next. That fear naturally drives many seniors to want every possible test just to make sure nothing's being overlooked. That's why treadmill and chemical stress test procedures that track how your heart responds under pressure have become so common among adults over 70. On the surface, it sounds like a reasonable safeguard. But here's the surprising truth: for a large percentage of seniors, particularly those without chest pain, shortness of breath, or fatigue, these tests often do more harm than good. The idea of a stress test feels reassuring. You walk on a treadmill, your heartbeat is monitored, and if something looks unusual, action is taken. But the reality is far more complicated. By the time most of us reach our 70s, the cardiovascular system naturally shows changes. Arteries become a bit stiffer, minor plaque buildup appears, and the heart may simply take longer to recover after exertion. None of these shifts necessarily mean disease, but the stress test can interpret them as red flags. And that's where unnecessary worry and unnecessary interventions begin. Many of the changes that show up on a stress test are nothing more than the normal signs of aging. But when those harmless shifts appear on a printout, physicians may treat them as warning flags. That's when the real danger begins, because those red flags can launch a cascade of follow-ups, angiograms, catheterizations, even the placement of stents that may not have been needed in the first place. And here's the hard truth: every one of those follow-up procedures carries its own risks, which hit seniors especially hard. Catheterizations can trigger internal bleeding strokes or kidney damage, particularly in older adults with fragile blood vessels or weaker renal function. And once you've taken the first step down that road, it's incredibly difficult to turn back. One test leads to another, and before long, you're stuck in a cycle of interventions for a condition that might never have affected your life at all. Take the story of Walter, a 76-year-old grandfather from Illinois. He was active, enjoyed daily walks, and loved playing with his grandchildren. He had no chest pain, no shortness of breath, nothing to suggest heart trouble. But during a routine physical, his doctor suggested a treadmill stress test just to be safe. The results showed a minor irregularity, which led to a cardiac catheterization. The scan revealed a small amount of non-obstructive plaque, nothing urgent. Yet the doctors decided to place a stent anyway. That single decision changed everything. Walter was prescribed powerful blood thinners, which caused severe internal bleeding. He was rushed to the hospital and spent the next 3 months recovering from complications that stemmed from a procedure he never truly needed. So why does this keep happening? Much of it comes down to fear of missing something, fear of what if. But aging wisely means choosing quality over quantity, focusing on energy independence and comfort instead of chasing every potential shadow. In fact, many respected cardiologists now strongly advise against routine stress testing in seniors without symptoms. The evidence just isn't there. These tests don't reduce heart attacks or extend life expectancy in older adults who feel fine. On the contrary, they often open the door to unnecessary treatments that may cause more harm than good. If you're not experiencing chest pain, unexplained shortness of breath, or unusual dizziness, the best medicine may simply be to keep moving, eat well, and live fully without the burden of unnecessary tests. The best approach as we grow older is symptom-based care. If you notice unusual fatigue, chest pressure, or a racing heartbeat during activity, then yes, seeking evaluation makes perfect sense. But if you feel steady, sleep well, and stay active, your body is already giving you a truer picture of your health than any machine ever could. As the years go by, aggressive intervention should give way to mindful observation. This isn't about giving up, it's about living wisely. You don't have to fight every single illness that might show up. What truly matters is preserving your dignity, your time, and your mental clarity. Aging does not mean weakness. In many ways, it's the moment in life when you're strong enough to pause and ask, is this test really for me? Sometimes the boldest choice is to step back. We live in a culture that constantly pushes more checkups, more tests, more prescriptions. But real wisdom comes from knowing when less is better. It's not neglect, it's understanding. It's respecting your body, your values, and the life you want to create. By the time you reach your 70s and beyond, healthcare shouldn't feel like an endless conveyor belt of impersonal procedures. Instead, it should become a conversation about your goals, your lifestyle, and the risks you're truly willing to take. Blindly following protocols designed for younger bodies can cost you years of vitality and peace of mind. And remember, doctors aren't trying to cause harm. They're working within a system that often emphasizes disease rather than celebrating health. If this video has encouraged you to pause, reconsider, or look at your choices through a new lens, then it has achieved its purpose. Declining certain tests doesn't mean ignoring your health. It means you're taking ownership, balancing pros and cons, and recognizing that not every exam leads to clarity. Some only lead to worry, overdiagnosis, and unnecessary treatment. So take charge. Ask your doctor honest questions. Find out whether a test will truly change your outcome or simply create more uncertainty. Value your comfort, your time, and your energy, because at this stage of life, they are precious. You deserve to live on your own terms, not out of fear but with wisdom. Not weighed down by endless procedures but empowered by knowledge. Not always bracing for illness, but actively building a life of joy, meaning, and connection. Thank you for spending this time with us today. We'd love to hear your thoughts. Share in the comments what insight resonated with you most and how you plan to apply it in your own life. Your stories inspire us more than you know. If you found this video valuable, please give it a like, hit subscribe, and share it with others who may benefit. Your support allows us to continue creating content that uplifts, informs, and empowers. We appreciate you, and we look forward to seeing you in the next video.